Hello. Hello, this is Dr. Akshay Mehta from Mumbai, cardiologist from Mumbai, India. And today I would like to talk to you about whether physical exercise can cause heart attacks and sudden deaths. And if so, how to be safe during exercise. Now, of course, this video presentation is for public education only. It does not replace personal advice and consultation with a doctor. Decisions about an individual case rests on a conversation with a personal physician and his or her advice, depending on the situation. Now, can exercise cause a heart attack or sudden death? Now, we all know exercise is very important for the body and the mind. But at the same time, every few months or during the year, we hear of a relatively young person suddenly collapsing with a heart attack or cardiac arrest in a gym or on the athletic field or on the sports field. And it disturbs us tremendously because these are young, productive people who suddenly die. So yes, there is a transient increase in risk of a heart attack or death during or immediately after exercise. Of course, the incidence is quite low. Very approximately, one can say about 1 to 2 in 100,000 sports people. The rates may vary from country to country, from the type of population taking part in the events, etc., and the ages, etc. But in general, this is 1 to 2 in about 100,000 persons. The disturbing fact is, as I said, it occurs in active and people who are in their productive age. And that becomes very shocking. But the good news, relatively good news, and men are more in women and more beyond the age of 35 than in the younger people. But the good news is that the chances of survival, if they are resuscitated promptly, are much better than people who have cardiac arrest at homes and in general when they are not on the sports field. So that is a good thing, but the bad thing is that it occurs in young persons and active people. Now, what is the cause? Basically, I would imagine there are probably 4 main causes. The first one is the commonest, which occurs in the people above the age of 35. And the reason is usually a combination of undetected underlying silent coronary disease, which they don't know, and vigorous exercise, especially if it is unaccustomed. For example, if a person is sedentary, he doesn't know he has heart disease or coronary disease, and then he starts doing vigorous exercise, there is a risk of a heart attack. In younger people below the age of 35, is usually inherent, like inherited or from birth, certain defects in the heart muscle, heart structure, or the electrical system of the heart, which can put them at risk. The third cause is in climates which are humid and very hot, that is heat stroke. And the fourth, which occurs in very high volume athletes who have run miles and miles, and in them over a period of years there is some scarring that occurs in the heart muscle and rhythm disturbances which can create problems like a cardiac arrest. So these are the main causes, but the most important cause is in people above the age of 35 in whom vigorous exercise in the presence of silent coronary disease can create a problem. Now, for this, one must understand the difference between the regular moderate exercise and vigorous exercise, especially if it is unaccustomed. When you do regular moderate exercise, there is some beneficial effects on the platelets, which are the cells which cause clumping of blood and cause clotting of blood. When you do regular moderate exercise, the tendency of platelets, which otherwise is to clot during exercise, a tendency, or their adhesiveness or their clumping tendency decreases. And at the same time, these natural fibrinolytic system, that means the natural uh, uh, capacity of the blood to dissolve clots is much better. So regular moderate exercise has these two benefits. As against that, people doing vigorous exercise have chances of platelet activation. Increased platelet activation means platelets have a tendency to clump. And this is dangerous when they have underlying disease like fat deposits in the coronary arteries. And, and during a very vigorous exercise, when there is a surge of stress hormones, and if there is a plaque rupture, this fatty plaque which ruptures, the platelets, which are highly activated, can clump there and create a clot and block the flow of blood and cause a heart attack. So vigorous exercise can create this kind of a problem, whereas regular moderate exercise is more protective. The other thing is in vigorous exercise in a person who has underlying disease can create, even if there is no plaque rupture, it can create a tremendous demand and supply imbalance. The demand of the heart increases because of increased pumping and at a faster rate. It requires more oxygen, which it gets from the coronary arteries. And if they are narrow, the supply is reduced. So there is a supply and demand imbalance, and the heart muscle suffers from lack of oxygen. And this can trip it into arrhythmia or rhythm disturbance, which can cause cardiac arrest. So this is another reason why people with underlying disease doing vigorous exercise can have a cardiac arrest. So if all this is a problem, why not avoid exercise? Well, the simple reason why you should not avoid exercise is that the benefits of regular moderate exercise are many. As we saw, the first one, decreased tendency of platelets to clump together and increased ability of the blood to dissolve clots. Effects on the mind, the depression, stress level, etc. are much less. Social support is better. And various risk factors which lead to coronary atherosclerosis or fatty deposit in the coronary arteries, which lead to heart attack. All that reduces by reducing cholesterol, by reducing blood pressure, by reducing obesity, by increasing the insulin sensitivity and decreasing diabetes and decreasing the inflammatory state of the body. Also, regular exercise stabilizes the heart rhythm by increasing the vagal tone and decreasing the heart rate and decreasing the sympathetic activity. So these people are more resistant to cardiac arrhythmias, people who do regular moderate exercise. And of course, it is anti-ischemic in the sense that the coronary arteries are more responsive to flow. They dilate. What is known as endothelial function is well preserved in these people. So there are a host of benefits because of regular moderate exercise. And these benefits outweigh the risk. Now, this is a very important diagram which can explain to you what happens and what is the difference between sedentary people and people who do regular moderate exercise. As you can see, the red dotted line is of a sedentary person, and the blue line is of a regularly exercising person. Now, as you can see, a sedentary person, when he's doing a vigorous exercise, his risk of heart attack or death increases 100 times when he is exercising. So if a sedentary person has to catch a train or a bus or run a race, his risk is 100 times as it would be when he was resting. Whereas a person who is regularly exercising, his risk during exercise is much less. And as the frequency of exercise increase from 1 to 2 days a week to 5 days a week, you can see that the risk, transient risk during exertion as compared to rest is much less than a person who is sedentary. Now, the bigger benefit from all this is that even that when the person is resting, as you can see this horizontal line, his risk is half the person who is sedentary. That means the person who does regular exercise not only has a lessened risk during exercise, but a lessened risk during his resting time, which is of course much more than the time you spend in exercise. So that means a person who is sedentary is exposed to the risk much more during rest as well as during exercise. So this is a very important feature, that though there is a transient risk during exercise, people who do regular exercise are much better off, and their benefits are much more than the risk. Now, so whatever the risk they have, why not reduce that also? So how to do that? So there are two main points. First is pre-participation checkup and advice. Before you start doing vigorous exercise, what checkups you should do, and what are the other precautions. So now, as far as the pre-participation medical evaluation is concerned, uh, there have been guidelines from European Society of Cardiology. There have been guidelines from the American College and American Heart Association. The main difference is that the European guidelines advise ECG for all, which according to the American people is not practical. But seeing the increased risk of Indians and South Asians, I think it is good to go with the European guidelines and have history, physical exam, and ECG of everybody who wants to undergo vigorous exercise. And this is basically done to detect presence of heart disease and to know whether a person has risk factors like hypertension, cholesterol, diabetes, kidney disease, etc. And also to decide whether further tests are required, like say stress test, blood test, echocardiogram, or even CT scan, which your doctor can advise after the basic history, physical exam, and ECG. Now, treadmill exercise ECG, who should undergo? Basically, it would be advisable for people who have symptoms like chest pain on and off, people who have heart disease, who have to be evaluated, or who have an abnormal baseline ECG. And it is also advised for people who have been inactive totally till now, sedentary, who have diabetes or other risk factors like hypertension, smoking, cholesterol, obesity, etc. Or who have a family history of premature heart disease. That means whose parents or brothers, sisters have had heart attacks below the age of 55 in males and below the age of 65 in a female relative. And if they have undergone a coronary calcium score, and if that is high, such are the people who should undergo a stress test before starting a vigorous exercise program. Now, there are other precautions that we should take. The most important is that the entry into exercise regime or routine should be gradual and should progress slowly. The dictum is start low, progress slow, and with a transition period of about 2 to 3 months from one stage to the other. For example, if you are sedentary, start regular walking. If you have been walking, start brisk walking. Be regular. Regularity is very important. The most important part of exercise is regularity, because it is like exercise is like medicine. Protection lasts only while you are regularly exercising. And as soon as you stop exercising, all your benefits, which we mentioned earlier on your lipids, your hypertension, or your blood cells, etc., everything tapers down within a few weeks. And then you become as highly risky as a sedentary person. So, so if you are exercising, let it be regular. And if you have stopped, then restart with the same start low, progress slow method. And physically inactive individuals should avoid unaccustomed vigorous exercise to begin with. So remember that moderate regular exercise is the best. It has low risk and high returns. And finally, learn to recognize symptoms and report your symptoms when you are exercising, whether in the training, whether during marathons, or wherever you are. If you have any kind of chest pain which is unusual or new, or pressure on the chest, or lightheadedness, or palpitations, or unusual shortness of breath, fatigue, or nausea, stop and report the symptom so that treatment and action can be taken. The other good habits to cultivate are very important is to ensure proper rest and sleep. If you have not slept well, avoid exercise that day. As it is said, it's the silence between the notes that makes the music. So it is a rest between two exercise periods that makes you more fit. Then keep yourself well hydrated. Very important. Then while you're exercising, see that your diet and sleep habits are good and you don't smoke. Because if you exercise and smoke, you are at increased risk. And every time you exercise, do warm up and cool down and stretch at every session. Finally, this is important to learn CPR because you may find your co-runner or your co-player suddenly collapsing and you are the nearest to that person to help. And three things that you must know is one is to recognize cardiac arrest. By recognition means if you witness collapse in a person, if you shout and shake that person and there is no response, and when you look at the abdomen of the person and see that it's not moving and the person is not breathing, consider this a cardiac arrest. And the first thing that you do is call for help. And as the help comes, by the time it comes, start a proper method of cardiac massage, which will keep the blood circulating to the brain and prevent the brain from getting damaged. And then when the help comes, the person can be revived with a defibrillator. So this is another thing that is very important to learn for all marathoners and all runners so that they can help each other. So recognize cardiac arrest, call for help, and start chest compressions. These three things one should learn. And what about use of aspirin? Well, the International Marathon Medical Directors Association in 2015 recommended a pre-race aspirin for males over the age of 40 after approval by their own physicians, after considering risks of aspirin such as gastrointestinal bleeding or allergy. So once they are cleared, they can be given aspirin because aspirin can prevent the clumping of platelets, as we saw earlier, which can cause a heart attack. However, this theory has not been proven. So it all depends on the dialogue between the sports person or the person who wants to start doing vigorous exercise and his own personal physician. So concluding, summarizing, transient risk of heart attack or cardiac arrest during or after vigorous exercise, especially if you have been sedentary before, is definitely there. There is a risk. But the benefits of risk or of exercise are much more than the risk, especially if you do regular moderate intensity exercise, which is very important to prevent cardiac complications. It combines safety with efficacy. If you want to do vigorous exercise, pre-participatory medical evaluation with ECG is very important. And this is not only important for people who want to start it, but also once every 2-3 years should be prescribed for people who are regularly exercising. Some people may require exercise ECG test. The dictum that one should follow is start low and progress slow. Note and report symptoms as you progress during your exercise routine. Maintain good habits of sleep, healthy diet, enough fluids, and finally learn to recognize and respond to cardiac arrest, which may help a person survive. So thank you very much. If there are any questions, you are most welcome. And I would welcome you to write your comments and subscribe so that we can update you with future such videos. Thank you very much.